I'm Adele Woods. I'm the Chief Executive Officer at Coos County Family Health Services. So at present we have a budget of about a little over $9 million. We have 22 providers. That includes physicians, nurse practitioners, and physician assistants. Our total staff is about 120. So we presently serve about 13,000 patients annually with primary medical care. We have about 52,000 visits annually. As a federally qualified health center, we have been very supportive of the Affordable Care Act to expand health insurance coverage for everybody in the country. We currently have about 1,200 or 1,300 patients who are uninsured, and I imagine that a good number of them will be eligible for the financially assisted offerings. We are very excited to see people go from uninsured to insured. And we know initially, though, that they will probably come in more often because they have probably deferred having some of their health care needs taken care of for lack of insurance coverage and not having the out-of-pocket money to pay for the care. And we're certainly very willing to work with any organization, whether it's our bi-state primary care organization, the HNH Foundation, the State Department of Health and Human Services, to further this coverage. We find that families in general will do for their children what they will often defer for themselves. So when we were going through the recession here in the Berlin area, and a lot of people lost their health insurance, we found that we could get them to enroll their children in Healthy Kids, even though the parents might not necessarily have coverage. But once we get the parents bringing the children in for care, we could talk to the parents about our sliding fee scale, and now we can talk to them about the options under the Affordable Care Act. In the long run, this is going to save the healthcare system money, because the people who are covered will come to a primary care physician for their needs rather than to the emergency room, which is very high cost. And if we prevent emergency room visits that can be handled in the outpatient setting by physicians, nurse practitioners, and physician assistants, and if we can prevent unnecessary hospital admissions because people have taken care of their preventive work ahead of time and they're getting their medications and their follow-up lab work and improving their lifestyles, that will in the long run contribute to a healthier society and will be better for our system and our country and our economy as a whole.